Well, we're joined now by the Sinn Féin Senator Fintan Warfield. We're also joined by Dr Mike Davidson of the Core Issues Trust Organisation, by Dr Paul Dalton, Senior Clinical Psychologist at St Vincent's University Hospital. Fintan, you're the person who's going to bring in a bill which would outlaw conversion therapy.
Yeah, and can I say from the outset, and in response to the video, that LGBT people form stable, loving and committed relationships equivalent to heterosexual families, and that the civil marriage equality referendum was the people's recognition of that. There is no scientific evidence to suggest that we can change or eliminate our sexual orientation. There is evidence, I will admit, that we can self-label our sexual orientation. However, the outcomes are always temporary and are unpredictable. When we think about self-labelling, many LGBT people will identify with that. From the age of 14 to the age of 18, I self-labelled as a straight person. That was a temporary arrangement that I came to for myself. I told myself that I would never love someone of the same sex. In doing so, I didn't love myself. The psychological impact of doing so is grave, and it has a lasting impact on your relationship.
Okay, we can talk the psychology with Paul, but in bringing in a bill that would outlaw this conversion therapy, are you really addressing a problem that is pretty insignificant? I mean, are there lots of people around trying to take gay people and say, we're going to straighten you out?
I'm in the Senate to stand up for marginalised people, for people on the fringes of our society. I make no apology for doing that. What I'm saying, and what this bill intends to do, is to ensure that people who are distressed about their sexuality or their sexual orientation are only offered interventions that accept and support that person for who they are.
Mike, you describe yourself as an ex-gay. Is that so?
Well, I never described myself as gay. I grew up in a part of the world and at a time where gay was not really a word that was...
But in today's word, do you know the meaning of the word?
Yes, I understand what you're saying when you say that. I'm somebody who moved away from the practice of homosexuality and have celebrated a successful marriage with my wife for the last 39 years.
Is it possible, without being too intrusive, that you're bisexual, and what you've done is you've completely suppressed one side of your sexuality and you've embraced the heterosexual side of that bisexuality?
I think we can put labels, whatever labels we want, on people, but I think the point here is that a person's sexual identity is something very precious to them, in the sense that they need to be the arbiters in what they describe themselves as.
But do they have a choice? I mean, there are people, they wake up in the morning and they are attracted to the opposite sex. There are others who wake up in the morning and they are attracted to the same sex. And they believe, and science believes, that that's immutable. Well,
I would take issue with saying categorically that science says that it is immutable. The Human Genome Project searched for a gay gene for a long time. They believe they have it in the case of males, by the way, but not yet in the case of females. And I was told this by Professor Luke O'Neill, Professor of Biochemistry at Trinity College in Dublin, who tends to know about these things. I think you would find that that is disputed, and I think you need to look below the headlines often and see some of the nuance of the science. Okay. I don't think it's
in your own change,
yes.
I mean, was that accomplished through prayer?
No.
Was it accomplished through maybe feelings of guilt that you didn't like what you were doing?
I was given access to supportive psychotherapists and one psychiatrist who took me seriously, who took me for what I was saying in terms of my desire and my aspiration to deal with an aspect of my life that I was not comfortable with. So it was not about prayer. It was about listening to me and building a relationship with me, sometimes challenging me.
Wasn't you saying, I don't want to be, we'll use the word gay as a shorthand, but it might not have been the word you used at the time. I just don't want to be gay. I want to be like the majority of other people out there. I want to marry, I want to have a family. So I'm going to do whatever I have to do to achieve that.
I was a man in a marriage already, but there was conflict. There was unresolved conflict. And my choice with my partner was to continue in the marriage and to see what could be done. And thankfully, I was given that. My problem with what we're doing here now is that we are not allowing people to have the equivalent opportunity that I had to get help from professionals.
Before I go to Paul Fintan, that you're saying that you don't want conversion therapy, whether it is quackery or otherwise. Lots of people go to all sorts of therapists these days. And Mike seems to be saying, look, if people want to try this stuff, why not let them try it? Why ban it? Why bring in prison, possibly, and certainly fines?
The law is there to initially deter, not only to criminalise. LGBT people experience high levels of mental stress, of suicidal ideation, of drug and alcohol abuse, similar to all marginalised groups in our society. And those issues are seen to be multiplied when a person has gone through conversion therapy. That is why it is so negative, and that is why the state should reaffirm the identities of our people.
So why not then, Fintan, why not regulate instead of banning? Why not bring people together so that there can be discussions as we are having today, looking at the hard evidence in science, looking at practice procedures and ethics? Why ban it and close down people's opportunity to explore different alternatives?
Okay, Paul, as a psychologist, a clinical psychologist, what do you think?
Yeah, I think there's a very clear answer to the point that you've raised. Almost every medical and mental health professional body across the world have disregarded conversion therapy as effective. I mean, this is going back as far as the early 1970s, when the DSM, the Bible that people go to look at mental health difficulties, said, actually, homosexuality is not a disorder.
A political decision that was made at that time, though,
well,
Paul.
what's really important is that we hear and respect the views of our learned professional colleagues who say very clearly, this is an intervention that does not work,
so
and
much
more importantly, does harm. Now, we have got a very serious issue when it comes to minors here. We've got a very serious child protection issue, because if there are therapies, and I believe there are, like this being used on young people and children, we've got to protect those, and we've got to protect them by legislating against this form of therapy that we saw earlier on sees the gay lifestyle as similar to alcoholism or overeating or a sin. Ireland has moved beyond that notion. This is an intervention that is essentially based on shame and guilt. And the Irish people have said, no, no more.
I think there's a touching reverence for those who have qualifications and who have a perspective. And it's important that there is scholarship and there is research done in all of this. But my fear is that there is viewpoint discrimination, because our research money that is awarded to researchers comes from one ideological position at the moment. Surely it's better to have research done from a range of ideological positions, and when it's brought together, that's the point at which we can discern truth from error.
You know, we could talk about research in this area for hours tonight. The bottom line is that this is an unethical practice that has been banned.
In your view?
Oh, no, not in my view.
In your view,
in the view,
yes, I agree, across the world, all of the mental health bodies. But here's the thing, Dr. Paul, there is a movement now, I would say, in the world, slowly but surely beginning to emerge, that is taking issue with a categorical and essentially ideological position that has been taken that does not allow for critique or debate. Don't ban, surely regulate, surely have different points of view coming together.
And this is the point of this conversation here. But our bodies have taken a position on this, have looked at the evidence, have said, no, this is an intervention that causes damage.
Okay, before we conclude,
destroys lives.
Fintan, have you got political support for this in the Shannon? I mean, it's all very well to introduce a bill, but can you get it passed?
We have 20 signatures across Fianna Fáil, Fine Gael, the Labour Party and the Green Party, Independents and my own party in Sinn Féin.
So you can get it through the Seanad?
I'm confident of that.
And then what? What about Dáil Éireann?
I mean, I presume the parties would be consistent as their colleagues would be in the Seanad.
All right.
What
Mike, last
boring
word.
politics, no opposition, no challenge, no critique, no debate. Just everybody closes down on one section of the population.
When it comes to human and civil rights, perhaps there's some merit in that.
All right, we will have to leave it there. Paul, thank you. Fintan, thank you. And Mike, thank you very much. That's about it for tonight.